Hello, this is Jennifer O'Brien, and this is a public service announcement for the medical community on the barriers to access to mental health services. Did you know that 51.5 million adults in the US, that's 1 in 5, live with mental illness? This could be depression, anxiety, PTSD, or a range of other illnesses. Oftentimes, we cannot see from someone's outward appearance that they are affected by mental illness, and it remains a silent struggle. Mental illnesses do not just affect one's mind, but have been associated with other diseases such as diabetes, stroke, and heart disease. By the end of this video, I hope you can take away 3 things. 1. Know and describe the barriers to mental health access. These include cognitive, affective, and physical and structural barriers, including the stigma of seeking help. 2. Have substantive reasons why mental health access is an important cause to care about and be able to support those reasons. In 2017, untreated mental illness cost more than $193 billion in lost earnings and was the most expensive category of healthcare for most employers. Tragically, and more importantly, the human cost is over 44,000 lives lost every year to suicide due to untreated mental illness. 3. Evaluate the usefulness of integrating mental health services in primary care settings. By integrating these services in primary care settings, it removes the barrier of sending out the patient to seek a specialist that works within their budget or insurance, their transportation accessibility, and provides continuity in care. Using a lecture with discussion and question and answer format allows for multiple points of view to be explored. By presenting focused questions and remaining open to others' ideas, critical thinking is stimulated, and finding solutions to these barriers to mental health access is possible. Another strategy is using visual audio aids like video clips. These videos should have a clear stated purpose before being played. Videos provide a way to indirectly participate in a scenario, but can still generate a full emotional response. PowerPoint is a user-friendly and useful tool to stay focused, present keywords, and enhance the teaching and learning for all involved. It is also easy to print out handouts of the slides to provide listeners so that they can follow along, take notes if they'd like, or write down questions for after the lecture. The TED Talk by Kitty Weston, entitled Breaking Stigma and Shame of Mental Illness, is a powerful 10-minute talk about her experience losing her daughter to suicide because of her untreated mental illness that allows one to feel her pain and journey with her as she finds her purpose in breaking down the stigma and barriers to mental health access. It is a personal video mixed with scientific facts that shows that while these barriers currently exist, they are not insurmountable and must be overcome for all who need it. In summary, most people in the U.S. have or know someone who is struggling with mental illness, even if they're unaware of it. Unlike a broken leg, mental illness does not always have outward signs, and so it can be hard to be aware of how prevalent it truly is. By understanding the barriers perceived by those with mental illness, we can better learn to dismantle them and make access to help and treatment easier. By joining the fight against stigma and working toward a future where mental health specialists are easily accessible, we can not only save billions of dollars, more importantly, we can save thousands of lives. Thank you, and these are my references.